teaching program for postgraduates in pathology. We are at the end of the second edition of this program, and we are going to end it with a bang. So we have two panel discussions coming up. Today is the first part of it. It is on the curriculum of MD pathology and methods of teaching. We have about 10 very eminent panelists on board who are senior people, who are either the heads of department or private practitioners, very experienced. Some of them have been in NMC. I invite each one of them to introduce themselves.
Yeah, maybe we can start with, has Sharda joined?
She's not joining today, ma'am.
Or Sharda is not joining today.
So these panelists are common for both the panels. Some of them are busy at a conference and they may not be able to join today. So I request the ones who are present to start.
Yes, all right. So I think we better call out their names. Let me start with myself. I'm Anita Borges, and I'm very much part of this online teaching program. And we thought that we are teaching online, and it has always been one of my pet, I would say, peeves that we've been doing this and for 3 years now, and we're going to start the fourth round of this online teaching program. And yet we haven't evaluated what impact that this teaching program has had on students or others who actually take part as learners in this program. I think Anshu knows that we've had some discussions on this. But apart from that, I think we both Sumeet and I thought that it would be a very good idea that we evaluate at least people's perceptions about the curriculum that is regularly taught, or individuals who are practicing pathologists now have, whether they are in academic institutions or they are in private practice, what are their perceptions of the pathology curriculum in all its dimensions. And later on, the next panel discussion on methods of assessment and evaluation of students who have gone through this pathology curriculum. So that's my point of view, and maybe I can ask each one of, I'll just call out their names so that we don't have a confusion. Anshu, would you like to introduce yourself? There you are.
Good evening, everybody. I'm Anshu, and I'm a professor at the Mahatma Gandhi Institute of Medical Sciences in the Department of Pathology. Presently, I'm also the president of the Academy of Health Professions Education, and I'm looking very keenly to see how this change of curriculum towards the competency-based curriculum will actually be implemented in practice.
Yes, I might add that Anshu has got a long interest in how to deliver a curriculum. That is, one thing is to devise it, but how to deliver it, what are the teaching methodologies, etc. And that's why she was one of the go-to people when I was trying to devise some way of evaluating our online teaching program. Now, Dr. Basu is not here today, but Dr. Basu, as you can see, is a professor at the Mahatma Gandhi. No, he's at Pondicherry. Now he's at MCRI at Pondicherry, and he's also a curriculum committee member. Dr. Sharda Rane is not here today, but she's a professor at GMC Baramati. She's also the president of the IAPM. Then Siddharth, would you like to introduce yourself, Siddharth?
I'll just come in for a minute. The years in the bracket are the years that each one of them have finished their post-graduation.
All right. Siddharth, would you like to introduce yourself?
Yes, I retired from AIMS, and I'm currently as an adjunct professor at St. John's Medical College, Bangalore. And I must say that I was involved with the UG curriculum, and I was a chief consultant at the Board of Governors and NMC in their transition period. So I have a disclaimer that what I'm speaking, it's not related to the NMC, it will be my personal opinions.
Thank you, Siddharth. Sorry, do you want to continue with something?
No, ma'am.
Right. Okay. Professor Iyer, Venkat, as he's generally known.
Thank you, ma'am. So my name is Venkateshwaran K. Iyer. I am professor and head of pathology at AIIMS. I chaired the committee which revised the NMC curriculum for MD recently, and this was updated in November of 2022. After which we also had a session during the AppCon 2022 in Bangalore, where a number of the panelists here also happened to discuss it. So I would be happy to welcome questions. Thank you.
Thank you, Venkat. Dr. Sita Lakshmi?
Good evening, ma'am. Thank you for having me here as a part of this team to discuss curriculum. I am a professor at St. John's Medical College in Bangalore. I teach hematology and transfusion medicine. I'm also actively involved in medical education. So I'm really happy to be a part of this group. Thank you.
Thank you. Thank you, Sita. Dr. Sachin Kale?
Yeah, good evening, ma'am, and thank you so much for including me here. I'm a professor of pathology at NGM Medical College, Aurangabad, and I also head a central pathology laboratory over there, which is a high volume laboratory. And also I do a bit of private practice. So I have seen both sides of the coin, academic as well as the private practice. And once during the PG activity, we were discussing some esoteric legion, and then somebody wondered that whether what we discuss here is really useful to the people when they pass out of MD pathology, and that's where we decided to conduct a survey regarding whether MD pathology curriculum is useful to the pathologists within first 5 years of what was their experience within first 5 years of passing MD pathology. So we conducted a survey and published it in IJPM, and that's how I'm involved in this particular discussion, because wanted to share that survey over here and what the young pathologists thought about the curriculum and what problems they faced. That's the whole thing.
Thank you very much, Sachin. Indu? Dr. Indu Nair?
Thank you, madam. I'm Dr. Indu, professor at Amrita Institute, Kochi. I'm happy to be a part of this panel. Thank you.
Okay. Asavri?
Good evening. I'm Dr. Asavari's son. I'm a practicing pathologist at Belgaum, Karnataka for the past 25 years. And after a gap of almost 10 years away from academics, I rejoined as professor in a Malaysian college. It's a college where there is collaboration with the Malaysian government. So we teach Malaysian students, but basically undergraduate, not postgraduate.
All right. Of course, you see in the center there, Dr. Sumeet Gujral. I think both he and Dr. Basu are traveling together, and their flight or something is delayed, so they will come. But everybody knows Sumeet. He, along with me, you probably see our faces every Tuesday and every Thursday as those who, on one of the slides that the moderators put up. Naveen, would you be?
Yes, ma'am. Good evening. I'm Dr. Naveen Kakkad, professor at Medical College and Hospital at Solan in Himachal Pradesh. My roots were in CMC Ludhiana, so I moved there only 4 years back. I try to teach hematopathology to students. Thank you.
Thank you. Dr. Vijay Shankar?
Internet, Wi-Fi.
Is he there? Has Dr. Vijay Shankar joined?
I think he's unable to join today. He'll join us in the next session.
He will join. All right, you have the next
Dr.
slide with the others on.
Dr. Sharda Rai madam is also here.
Hello,
Please introduce yourself.
Good evening.
Sorry, Dr. Sharda Rai. Yes, please.
Yeah, thank you, ma'am. Good evening to all, and it's a great privilege to be part of this discussion. I'm from Kasturba Medical College, Mangalore, with 25 years of teaching experience here. So, looking forward to sharing my views and listening to others' opinions. Thank you, ma'am.
Thank you, Sharda. Can we have the next one?
Ma'am, we also have Dr. Sharda Rani madam here.
She joined?
Yes, she just joined. I can see that she's just joined.
Good evening, madam. Right. Good evening.
Madam, would you please put your video on?
Yes, and please introduce yourself, Sharda.
I'm traveling. So, yeah, I'm traveling.
But please introduce yourself, Sharda.
I'm professor and head at Government Medical College Baramati. And actually, I am a product of BJ Medical College and I have worked there for 30 years. And since 3 years, I'm here. So total 34 and a half years of experience post-MD as a postgraduate teacher. And I'm a surgical pathologist.
Okay, you neglected to say something interesting that you are, and important, that you're the president of the IAPM. Yes, Sharda, that's why you're traveling the length and breadth of this country.
Yes.
Yeah. All right. Anybody else have missed out on this screen? No. All right. The next one.
Moving on from the senior faculty, this session would be incomplete without our younger panelists. These are all the early career pathologists who are either into private practice or teaching hospital. I would like to invite my friend Kirti, your colleagues, to introduce herself.
Hello, thank you so much for giving me the opportunity to join this session. And I am basically a student of Sharda Rane Madam from MBBS and passed out from KM to the 4 to 5 years of academic. Lastly, I was associate professor in Vedanta Institute of Medical Science. Meanwhile, also I had my private lab previously in my career, and after that I joined another private labs. Currently, I'm working in a Krishna Diagnostic as a zonal manager in Nasik. Thank you so much.
Thank you, Kirti. Gopal, introduce yourself, please.
Good evening, all. I am Dr. Gopal Parikh. I am my PG is from GCRI Ahmedabad. Later on, I work with TMH Mumbai as a senior resident. Currently, last 10 years, I am working as a consultant histopathologist in private lab, Ahmedabad.
Thank you, Gopal. Payal, please go ahead.
Yes. Good evening, everyone. I'm Dr. Payal Bhatt. I completed my MD Pathology in 2021 from Pramukh Swami Medical College. And since then, I am working with Jaslok Hospital and Research Center, Mumbai as junior pathologist. I'm delighted to be a part of this panel. Thank you so much, ma'am.
Welcome. And Prasad, introduce yourself, please.
Good evening, everyone. Namaskar. I am Prasad Dange. I passed out MD Pathology in 2014 from Maulana Azad, New Delhi. My UG was from Mumbai. And after that, I have worked in Jipmer Pondicherry and AIMS New Delhi as a DM hematopathology resident, then JJ Hospital in Mumbai, AIMS Raipur, and now finally I am faculty in AIMS Guwahati. Unfortunately, I don't have experience working in private sector, but I do have experience in academic sector. Thank you.
Thank you, Prasad. Moderating.
Would you like to introduce yourself, because you are also going to take part in this?
Yes, so I'm the moderator as well as one of the early career pathologists. I'm Dr. Shrutika Java. I'm a hematopathologist at Jaslok Hospital. I did my MD from Nair, followed by fellowship from Tata Hospital. I worked in Nair Hospital as an assistant professor for 2 years. So I do have some experience with the medical colleges, and now I'm into an institute-based practice. So I hope to use this platform to raise my concerns and opinions.
Okay, Nisha.
Session is.
Is Nisha there? Nisha, please introduce yourself.
Yes, ma'am. I'm Dr. Nisha Modi. I'm assistant professor in private medical college Indore, and I finished my MD in 2016 from Tata Memorial Hospital, Mumbai. And after that, I joined AIMS Bhopal as a senior resident, and then thereafter, I've joined this medical college as a faculty.
All right. So thank you very much, Shrutika, for having put up all these things and facilitated the introductions. Can we go to the?
Sure,
what we noticed, I don't know how many participants we have at the moment. Let me see. We have 74 participants, which is, I think, a good enough number. But we'd like to know what the participants, what is their affiliations, what they're doing, how many are postgraduates, how many are in academics, etc. So Shrutika will just put up some poll questions, which I urge all the participants to answer, so that during the discussion, what's happening in the chat box, and then Shrutika can sum up at the end.
Sure, I'll do that. So this webinar is hosted by Dr. Anita Borges, consultant pathologist at Center of Oncopathology, Tata Trust, Mumbai, and Dr. Sumeet Gujral, who is a professor in pathology at Tata Memorial, Mumbai. Few reminders if you lose your connection. Please answer the poll questions by clicking on the options that you get in the chat box. Couple of disclaimers before we move on with our poll. We have an upcoming session. We'll be talking about it at the end of the seminar. So yeah, let's start.
Shrutika, where do you want them to answer the poll?
Ma'am, that would be, they will get the options in the chat box. They can click on it.
All right. So just give them whatever instructions you need to.
I'll just have to type the polls real time because that is how this platform would work. All right, I have opened a poll so you can see the questions at the main screen. The first question is, please select your years of work experience as a pathologist. Option A, less than 5 years, 5 to 15, and more than 15 years. You can see option B and C in the chat box. Please click on it so that we have your answers recorded. I urge all the participants who have not yet responded to please put their answers. I'll be closing the poll in the next 10 seconds. All right. So we do have the answers, ma'am, and most of them we have an equal number. Some of them are less than 5 years, some are mid, and then some are senior pathologists who have joined us today. We move on to our next question. Have you ever enrolled in super or subspecialization, either in the form of a fellowship or senior residency or some certification course? The poll is open. So almost our attendees today have not done any specialization after MD. Ma'am, can you also see the responses?
Yes, I can. Yes, I can see the
All right.
responses. We don't have very many responding, unfortunately.
Yeah, I think they're still trying to figure out. So maybe for this question, I'll give some more time so that they can figure out where exactly to put their responses. I repeat, please put your answers in the chat box. Do you work in a hospital-based laboratory, a private lab, or a private lab which you are owning yourself, a medical college, or you're still looking for a job? The poll is open. We do have many people from medical colleges. All right, moving on to the next question. What is the major area of your work? Which specialty? Hematology, clinical pathology, clinical biochemistry, cytohistopathology, blood bank, or a combination of this? The poll is open for answer.
Shrutika, there's no G in your poll. Huh?
Sorry?
In the poll, G is not reflected.
Oh, oh, I'm sorry.
That's all right.
It's the last option. So the last option G is an overlap of some of the above. So a couple of us who do everything in a day.
But I don't think that there's a bar or to.
There is the option, ma'am, in the poll.
Yes.
Yeah, it's there.
only
In
A
fact,
to F.
no, ma'am, it's there. If you can just scroll up the screen, you'll be able to see. In fact, most of the answers are for G.
Yeah, I understand. Oh, yeah, sure. Sorry.
Right. All right. So as expected, most of us have an overlap of all the specialties. Moving on to the next question. Grade your confidence in reporting in the major or chosen field of work immediately after passing MD. The crux of the question is right after passing MD and not many years after that. Option A is very poor confidence. Most of us would get sweaty hands and cold feet type of low confidence. Option B is minimal confidence where we still need some supervision. Option C is moderate confidence where we would report and then pray for it to be correct. And option D is we are so we can hold our own with the clinician and discuss the case with the consultant. This would be interesting to know. So good to know that not many people have very poor confidence. And there are equal number of candidates here who have various grades of confidence when they pass out.
But many have not answered.
Yeah. Well, this is an anonymous poll. Nobody is going to know who has written what. So please feel free to put in your answers. All right. Moving on to the next question. As a fresh, please grade your knowledge of automation and troubleshooting in pathology analyzers. Are you completely aware, unaware? Do you think you're experienced to some extent, or you think you're confident and ready to take on the machines? Also, I request everyone, I think they are trying to type their answers in the chat box. Please use the option of the poll. Click on that. That is the way your response is going to be recorded. All right, so most of us have some experience in handling the analyzers. That is what the poll says. Moving on to the next question. What is the accreditation status of your laboratory? It's already accredited either NABL or by CAP. It's in the process of application, or you're trying to get the documents together, or it's non-accredited and you don't intend to accredit it. So again, we have a mixed bag response. We are in various stages of accreditation or have no plans at all. And moving on to the next question before we go on with our discussion. As a fresh MD pass out, rate your knowledge of quality assurance and quality management systems. I'm sorry, there is ABC, but it's obviously in that order. Either we feel totally lost when it comes to QA and QC, or there is some familiarity with the terminologies, mainly because there was an LEQ or an SAQ to answer. Or the other extreme is that you are confident to drive a lab till the NABL application stage. Great. So as expected, most of the answers are, they have some familiarity with the terminology, and I think that's still a good start. So with this, we end the poll for today. And I now request Borges ma'am to take over and...
Thank you so much, Shrutika. I think if we can stop sharing the...
Yes, ma'am, I'll do that.
All right, and Ruchi, can you just have us, those participants on the screen, and can you sort of make certain that the others are not on this panel? Is that possible, Ruchi?
Ma'am, if you can zoom in to the screen at the top, there's a bar at the top of the WebEx platform.
Yeah, I can see that, but there's a whole lot of, participants, and everybody else is also seen, but it doesn't matter. We can start. Well, welcome everybody after this poll. I did see that the majority of people did not actually answer this this poll, but perhaps they were not sure of what their answers were, or some of them may be postgraduates, and if they are postgraduates, they would find it difficult really to answer the poll. But I'm just curious, because one of the questions that was asked over here, and maybe I can ask it to those of you who are in the in our panel. Maybe I can start with Shrutika. Shrutika, is your,
yes,
since you asked that, I think number 7 was the poll question. Is your lab NABL accredited?
Ma'am, we are in the process of applying.
You're in the process. Nisha? Nisha, are you there?
And we are also in process of applying.
In the
Maybe by
process. Gopal?
yeah.
Ma'am, my clinical lab is NABL accredited, but histopathology is not included in the scope.
It's not included in the scope. All right. Kirti?
I'm in the process. I'm in the process of enable accreditation.
Okay. And Payal?
Ma'am, the place where I did my MD from was NABL accredited. Right now, just lok mein hu, so it is in the process of applying.
It is in the process of applying. All right. So both you and Shrutika are just look, right?
Yeah, colleagues, ma'am. Yes.
Okay. Can I ask Prasad?
Ma'am, it's not not accredited.
It's not accredited. Sachin?
No, ma'am. We have just
Yeah, clinical lab is accredited, ma'am. Microbiology and clinical lab, along with molecular. But histopathology, cytology is not in the scope.
Okay. Vijay? Vijay, are you there? No? All right. Okay. Savari?
My lab was accredited for everything other than histopathology, but I have
see.
not renewed my accreditation.
Okay.
I have
Indu?
reasons for that, which I can share later.
Madam, yes, madam. Ours is accredited. NABL accredited.
All right. Sita Lakshmi? Sita?
There. We are an NABL accredited. Yes.
You're NABL accredited. Okay. Venkat? Are you there?
They are not accredited.
You're not accredited. Okay. Basu is not there to ask. Anshu?
I am there. We are accredited in Tata Hospital.
Yes. Okay. What about Basu? Has he joined?
Basu is not. Basu is not joined today.
All right. Okay. Anshu?
We are in the process of applying.
You're in the process of applying. Okay. Sharda?
Our hematology and cytology was accredited in 2009. Histopathology is in the process of accreditation.
Sorry, who is that? Sharda from Manipal?
Yes,
Bangalore.
yes. Mangalore.
Yes, okay. And Dr. Sharda Rane?
I am in new medical college, which is just started 3 years back. So my lab is not yet accredited.
And what about your BJ Medical College?
Medical college, we have a histopathology, which is accredited, but not a clinical pathology.
Okay. And Siddharth, I'm asking about St. John's, so I suppose, or AIMS. AIMS was not accredited, right? Siddharth, are you there? Siddharth seems to.
Yes, ma'am. St. John's is Dr. Sita Lakshmi already told you.
Yes, but AIMS was not.
AIMS was not. Ma'am, can I
Please.
share an interesting thing, ma'am?
Yes.
Slide. Okay.
Yeah, just please share it.
Yes, ma'am. Can you see it, ma'am? No.
Yes, yes, we can see it.
Okay. Ma'am, this was an actually what you did was a right thing, I think, because you see, there's no data about our country regarding the labs and number of pathologists. These are two estimates. One was presented in the US CAP, which is the global estimate, and it clearly shows that there's a dearth of pathologists here. There was another study in which there's a global workforce capacity which was estimated worldwide, and it says that we need at least more 50,000 to 2 lakh pathologists for the purpose of future pathology, that is pathology and lab medicine, now that precision medicine and other things are coming. So this is the workforce. But if you see our data, ma'am, if you see in this one, sorry, if you see our data, there's no authentic data. Estimated active pathologists are estimated.
Siddharth, we can't see your next slide.
No, this slide.
This is, now
we can see.
No,
No, it's gone back, Siddharth.
I'm reading that only. Not the next one. There are about 20 to 25,000 active pathologists, and labs are estimated to be 50,000 to 1 lakh. But there is no data, ma'am. The NABL, their website as on 27th few days back, it showed only 2,229 labs accredited. The vast majority are not accredited. We do not know about them. And that includes big institutions also. There's a National Register for Clinical Establishments from 2020. There are lakhs of clinical establishments, and depending on their 4 levels, labs are included in that. Supposing we take all of them, about 37. So actually, about 40, there is data maybe on few labs in this 37,000 and of NABL. So you are absolutely right in asking people. Unfortunately, accreditation and there's no data on the number of pathology. Or we have so many pathologists passing out, ma'am. We have about 3,000 pathology seats every year. That includes about 2,800 from the NMC, from the National Medical Commission stream, and 115 from the DNB stream. And you see our IAPM registration is hardly anything compared to this. So I think that's one of the biggest problems that we have. You're absolutely right in that.
Yes, I think, Siddharth, there are a lot of people. I don't think that either the NABL or the IAPM figures actually estimate the number of pathologists. You are right to have shown this. We have no figures at all. And I think that one of the first things that it's not relevant to this discussion, except in a very sort of lateral kind of way. But, the Indian College of Pathologists, which is part of the function of the IAPM, should be the first thing that we should be doing is actually collecting data on the number of pathologists. And I think if we could do that, those who are in practice, those who are in academia, which anyway is practice, unless we do that, I don't think we know what we are preparing students for.
Yes, that's exactly what it is.
And I think, and that is really something that we should take on as a war footing. Thank you, Siddharth, for providing this.
I want to stop this.
This information.
Thank you, ma'am.
It's very welcome because it throws ice water onto a lot of the discussions that we have been having about academics and how to get pathologists to, because we really don't know what we should be preparing them pathologists for. So I thought that that may be a good jumping off point, Siddharth, to talk about what is real world pathology. And I think let's take that question first, because Siddharth has given us a really good jumping off point, and so that we don't have too many voices all speaking together. Maybe I can start with the young people over here. Although I know Asabari, you are young, you're much younger than I am, but since you have done a lot of your pathology career has been in private practice. You started in private practice almost immediately after you passed your MD. Can you tell us what you think is real world pathology?
Yeah, well, I think real world pathology for me 25 years ago was a whole lot of learning on the job, because we were never taught about automation, first of all, and we spent more time learning histopathology, whereas in my lab, when I started the lab on day one, I was doing only biochemistry. Hardly anybody sent me histopath to start with, or even cytology. More of my energy was spent in getting licenses, managing people, and money matters as well. So real world pathology as a private practitioner who wants to start a lab involves a lot of management, which I think should be included in the curriculum. And I'm told that abroad, most of the pre-medical courses have an MBA either in finance or management. So that would be, I think that was lacking in my time. Over the past 25 years, what I have observed is, unless you are really a very good surgical pathologist, most of us, we spend our careers in isolation. We don't get too much of interactive, kind of opportunities to interact with clinicians unless it's really about, a biopsy report, because other things they would not involve you in management. I'm also attached to an ICU. I also run a ICU lab actually in a hospital. But even there, they would probably just ask the report um, more to the technician than interact with me. So that I feel they just don't. I miss that interacting with clinicians. Other than that, I think majority of the times I spent more time learning about quality for biochemistry reports than for histopath and
Okay. I see that.
cytology.
Right. Okay. Kirti, you are somebody who's, passed out fairly recently. You did your MD from BJ Medical College, right? Kirti?
I did my MBBS in 2003 from BJ Medical and passed out from KM in
Okay.
2014.
All right. So now you are in private practice?
Yes, ma'am.
All right. So would you like to say what is real world pathology? And do you
Yes, ma'am.
find that it was divorced from whatever you learned at KM?
Not completely, ma'am. Like if I take a hematology, histopathology, and cytology, and clinical path, so I was confident enough right from the I pass out. But with the biochemistry section, I really work hard to know the machine, how is the automation goes, how the quality control goes, even regarding the QC, the accreditation process. This exposure was not there during my MBA, which I really worked hard. Again, the blood bank field, I'm not got exposure that way.
All right.
So these
Would
two
you say,
fields
would you say,
like
Kirti,
I
that
have to work
at
upon.
KM, the clinical biochemistry was not part of the pathology department?
It was there, ma'am, but we have not been an active participant to handle the machine, to run the samples, or to in all to handle the what were the troubleshooting of the machine. So we were more stuck to the microscopic part of the reporting.
All right. Payal?
Ma'am, according to me, real world pathology extends far beyond the application of theoretical knowledge that we gain during the residency. It encompasses the intricate management of personnel and rigorous maintenance of quality standards and their troubleshooting. Even equipment validation, verification, everything we are not taught during residency, IQ, OQ, PQ, then maintaining the QC, TICAS, interlab comparison. And one more thing, ma'am, for an example, till the time I started my practice, I didn't know that change in the conductivity of water in machine can lead to change in electrolyte levels, alkaline phosphatase level, and all. Matlab, these basic things I learned after starting my practice. This weren't taught during residency.
All right. Gopal, would you agree with whatever you have heard so far? And then I will come to those who, have been teaching pathology.
Madam, as I'm working in histopath, I think initial few years are very difficult for new pathologists to report independently, sign out the histopathology reports. Everybody wants reporting like Borges, madam. So, matlab, they want that level of confidence. Initially, they don't accept your report. Matlab, if you give some odd or out of the way, matlab, rare diagnosis. Over the time, it required your confidence and your connection with the clinicians. He understand, okay, you are also capable, and first initially few years they send your reports from
So
second
what I
review.
understand, Gopal, is that you didn't do a general practice. For you, the real world was histopathology. And histopathology is, to a large extent, given the answers that I heard just now, is dealt with in quite a detailed kind of way in during your postgraduate degree. Maybe you're not terribly confident when you get out, but as far as clinical biochemistry, clinical pathology, hematology, the exposure perhaps may not be as as you want to. Now that I've talked to them, and I'll come to you, Sachin, in a minute. Um, can you tell me, Venkat, do you prepare your students for the real world? Because the students are telling us that those who are practicing in the real world are think that the real world is something divorced from whatever they picked up or they learned at. So, can you tell us what goes on at AIMS?
Yeah, so before I tell you about what goes on in AIMS, when we were writing the new MD pathology curriculum, this issue was extensively discussed as your participants have expressed. And we changed the system of fixed postings to ranges. If you look at the new NMC curriculum, we have given a posting range. It is for the states and the university to select how many months they will post each student in these. As long as it is within the range, the NMC is all right with it. Now, it's for the student to also have some knowledge when he's taking MD pathology, what he wants to do after he finishes his MD. So if his aim is to set up a private lab in which he's going to do a lot of biochemistry and biochemical tests, he should choose a course or choose the college where the number of months posted in lab medicine is higher, rather than choose a college where that number of months is lower. So when you go for your counseling, when you have your MD entrance, your NEET entrance, you should have this much of knowledge. A lot of times what happens is that students go there opting for other subjects than pathology, and then when pathology is opted, they choose whichever college they know. Now that is ill-informed decision making, and we can't help that. But I would prefer that students have a clear knowledge of what they want to do before they take up pathology and choose the course which is meant for them. Now, the other issue which was discussed at the curriculum committee as well as in AIMS is the fact that now laboratory medicine has been separated out from pathology. It is now a fact, we have to deal with it. And therefore, things which were happening before are going to change a little bit. At AIMS, we have a different separate department of laboratory medicine. Those who want to do laboratory medicine take that up. Some of our residents who pass out of pathology do senior residency in lab medicine because that's what they want to do, and they don't want to train in histopathology. So in our department, what we do is only cytology and histopathology, because both lab medicine has been separated out, immunology has been separated out, which is together with HLA, and hematology has been separated out. So we rotate our residents in these three departments for gaining some undergraduate, postgraduate knowledge. But our focus is training in our area. So we don't encroach on the others. Once you do the MD pathology, after that you have to choose where you do your DM or where you do your senior residency, so that you can complete your training.
Right. So you would accept, Venkat, that the AIMS system is perhaps quite different from the system that exists in what I would say run of the the run of the way medical colleges that are mill medical colleges that are all over the country, except for maybe the AIMS all over the country, and perhaps to some extent PGI as well as JIPMER and some of these medical colleges. But I would like, some of the teachers, maybe Siddharth, to comment on what Venkat just said, that students should make up their minds before they get into a pathology course to decide what is their ultimate aim, what is it that they want to do, and then accordingly choose the course. How practical do you think, or choose the college, how practical do you think that is, Siddharth?
Ma'am, in the current scenario, I think it's a little difficult. When I joined, ma'am, AIMS, I wanted to do pathology. We had to appear in 2 papers. The morning session was a general paper, which is the current NEET PG or whatever. In the afternoon session, we could choose 2 subjects, and I had to appear in a pathology paper. That was also an MCQ in pathology. They would add up both the marks. I was not eligible for any other subject because I appeared in pathology. Only those who appear in pathology, a merit list is prepared with them. I tried to bring back that, but unfortunately, we have to align with the general system in the country. So they said 2 papers or 3, it's not there. It's there in our DM, where a cardiology will appear in the cardiology paper and so on and so forth. It's not there in it. Now, currently, if you see, ma'am, can I just share a slide now? Once again? Sorry, I'll share this slide. Currently, if you see the yes, ma'am. Can you see the slide, ma'am?
Yes, yes, sir.
Yes. Ma'am, currently, if you see, about 10 lakh students pass out, and then there are about 50,000 MDMS seats, and naturally these seats will be much lesser, the DNB seats. Out of these, ma'am, if you see, there are some diploma seats, you forget about it. The pure pathology are 2815, and lab medicine at present, there are only 3 colleges. One of them is, of course, AIMS, and there are other AIMS and a private college, and there are only 17 seats. So what Venkat is saying is right, but unfortunately, there is a big mismatch between the number of students who are likely to take up lab medicine and come out and then get into mainstream pathology. And if you see the undergraduates, 2.7% ultimately opt for pathology. Fortunately, all the pathology seats get filled. But to tell you the truth, ma'am, pathology is generally not the first choice in most of the, it may be some students who come to AIMS, but elsewhere. I have seen people with a permutation combination of college and subjects apply for over 100 combinations, and then the computer decides you depending on your marks. So you see that pathology is often not the first choice, and that's one of the problems. Then if you see the US also, ma'am, in fact, about the number of students who have been absorbed into pathology, they have about 600 seats in residency, about around 35,000 residency positions totally. And the total undergraduates are about 28,000. So the number of residency positions are more. About 1.6 to 1.9, it varies from different, less than 2%. In India, fortunately, it's about 2.7% of the seats. This is the problem everywhere.
Yes.
But in US, if you take the US students, in the top 5, pathology doesn't figure. If you take the international medical graduates who come there, it's surprising, pathology figures in one of the top 5 of their matching, they want to pursue pathology. So there are very few hardcore, really people who want to join pathology.
Yes, Siddharth, I think you're right. I think that that is a subject that maybe we can discuss at another time. But you know, the frustrations of people who probably wanted to do some form of clinical medicine, and they have now joined pathology. But nonetheless, since we're discussing a curriculum, those who join pathology at least should have some knowledge of what you know, real world pathology is when they are going through their curriculum. Maybe I can ask.
Sachin Kale has done a wonderful study recently.
Yes, so that's
and
what I was going to ask.
He can
Sachin.
talk about it. I've
Yes,
made the
Sachin,
graph
please.
for
You
it.
know, I was coming to you
Yeah,
about
yeah, yeah. Yes.
because you have done a study on this, and
So I'll This study was carried out about a couple of years ago, and what we found that about 70% participants were females, and that is a general experience in most of the teaching departments also. So we have scientific at MJ Medical College available. Then
Sachin, I can't hear you very well. Sorry, I have to interrupt you, but I can't hear you very well. Can you?
Yeah. I speak slowly, ma'am.
Yeah, okay, yes. And maybe a little loudly. Yes.
Yeah. This study was conducted about 2-3 years back, and we found that about 70% of the study participants were female.
Sachin,
So,
your voice is very shrill and.
Yeah, but I think that's
I will stop my video. Is it better now?
Yeah, okay. Yes, carry on, Sachin.
So I have stopped the video. So this study was carried out about 2 years back, and 70% of the participants of the study were female. Am I audible?
Yes, yes. Carry on, Sachin. Yes.
So in most of the departments also, pathology seems to be a more chosen subject by female rather than males. Why that is, I don't know, because initially there was impression that pathology is a very cool branch, but it is not so. It's, people discover after joining that there are so many things to be done during MD pathology. You have to attend blood camps, you have to attend night on calls where you have to see CSF and a lot of other things, and there are important cross matches to be done. So it's not a cool branch as it is presumed while joining the pathology. So it's a shock for some of the residents that there is so much work in the pathology. That is one. Then we found that I'll just read out few things that we found out. The graduating MD pathology students that we surveyed expressed confidence in reporting routine cases of hematology as the same features that we found in the survey that you just carried out. They were confident in hematology, clinical pathology, routine cytology, and histopathology. Even in routine histopathology, they were confident, but there was some difficulty in clinical biochemistry. The same was reflected in the survey that you just carried out. And you went one step further, you asked about automation also. So that was a good thing. As far as my experience of teaching, I had a central lab where biochemistry comes under me. So we have a biochemistry assistant professor who is posted in central laboratory. And our pathology students are lucky in that they get a complete exposure to us, to a patient. So if they see CSF, they will also see the glucose and protein along with the CSF, which we never used to get exposed to. We had to call our biochemistry friend to know the biochemical findings. So if there is an anemia, they also know that it is an anemia of renal disease because the urea creatinine is right in front of them. Iron studies are right in front of them. So this integrated thing is there, for which they get exposure. But we are also NABL accredited. We ask them to see the QC daily. But still, because of the other workload, they are not able to go into too much detail into troubleshooting the analyzers. Though huge analyzers are there in our lab, and the biochemistry analyzers are also there, fully automated, integration is there. But still, they are not able to pay attention to this particular thing because of other load.
Right. So, Sachin, what you're saying is, from what I can, if I would encapsulate what you're saying that there is a lot of stuff to study in pathology, and that many medical colleges perhaps don't, afford the kind of time that is required for this. And I take that also from what Dr. Venkat said, is that they are now, sort of in the new curriculum, there are going to be ranges, so that I don't think that the student has a choice as to what kind of range he is, that he can spend in any particular department, depending upon what his inclinations are, because individual colleges will obviously decide. But there is a lot of work, and perhaps there is not much coordination, which brings me back actually to the curriculum. The curriculum that was in force up to now and is probably going to change. And maybe I can bring Anshu in, because she's done some work on the curriculum. And Anshu, can you actually, she's did as she said, no, she's done a master's in teaching and pathology curricula, etc. at Maastricht. So maybe Anshu, you can tell us what you found were the deficiencies of the system, but more than that, what did you find was very good about the system?
So the curriculum that I analyzed as part of my master's was the MUHS MD curriculum, and this is the one which has come before the one Venkat and all have worked on. So I found that the rotation and the postings that you have, they gave students a comprehensive exposure to all branches of pathology, and this apprenticeship kind of training that you have, that you in every section that you have supervision and you learn on the job. This has been emphasized in almost all sections. There was good exposure to autopsy pathology, and clinico-pathological correlation was done well. A fairly good exposure to research and medical statistics. And overall, we found a good balance of what is done in theory and practical. And in the curriculum, at least I don't know how much it was implemented then, there was emphasis on quality control and quality assurance. Now, the previous curriculum that we talked about, the competencies were not very well defined. When I went through this new curriculum, I find that most of these things have been better defined now in the new curriculum. But however, I still find that there is overemphasis on surgical pathology, and we need more emphasis on clinical pathology and laboratory medicine. I do not agree with what Dr. Venkat just said here, because I think when one is doing a MD pathology, you need to give a broad outline of all branches to a student here. And jumping into specialization too early will make them, know more and more about little and little. So, and at that stage, as Dr. Siddharth said, most students do not know what they want to specialize in. So our job in the department will also be to give them an idea of where of learning about and discovering where their interests are. So I don't see why we should not have an elective kind of thing which undergraduates have. So if they know finally what they want to do, maybe an extra 2 months doing maybe nephrology or neurology or whatever they want to. The other thing which I found was weak, which all of you are saying, is that the managerial, administrative, and leadership skills are not very well defined were not very well defined in the previous curriculum. They have been added now, but you'll have to see that most people do not venture into teaching hospitals. Most of them jump into practice, and there they start off with how to set up a lab, and they have no experience about it. They struggle with how to deal with their staff, the financial issues. So all of that is missing from here. And even if you look at our examination system, we emphasize on the people and how many slides they see in surgical pathology. Real world is completely different. The other thing is, recently I've been involved with as a consultant with Bill and Melinda Gates Foundation, where I had been asked to go to some states and do the baseline assessment because they're working on a project on strengthening of labs. The situation was appalling. What we see in Maharashtra is very different from elsewhere. I can't name the labs, but there were medical colleges in state capitals where a microtome has not been working for a whole year. I don't know what students are learning. The system in the whole state is that the laboratory medicine comes under the medical superintendent, and the rest of it comes under the dean. So they don't even communicate, and the hematology is carried out by either a BAMS person or a MD physiology, and no pathologist is involved. It's just the technician running a CBC sample, signing the sample off. Nobody looks at peripheral smears there. And students, PG students are sent for the 24-hour postings, and they are there for just 2 months without any supervision. So I don't know what they're learning there, but what we see in one part of the country is completely different from what we see elsewhere.
Thank you so much, Anshu. That has given us a little bit of an insight. Now, I'd like to ask, Sita Lakshmi, who is at a very good medical college. That's at St. John's. Sita, what are your insights on whatever we've been discussing so far? Do you think that our curriculum, I'm not talking about the new curriculum that will come. We can discuss that because we have Dr. Venkat here, who's been part of, and Anshu has seen it as well. Tell me, do you think that our curriculum actually prepares students for whatever the real world is. I think Anshu has talked about it. Asavari has talked about it. So many have really said that they are like babes in the wood when they get out, because they really don't know anything about managing a laboratory.
Yeah.
Now maybe in some parts they have some idea of what automation is, because gone are the days, I think, when any laboratory is devoid of some kind of automation. But maybe the students don't get a good handle on that. What are your views on this, Sita, and how is St. John's taking up this?
Yes, ma'am. Thank you so much for asking me these questions. I'm eager to answer them and share my views. Yes, I will speak on behalf of my institution as well as on my own behalf. I've been teaching for almost 3 decades now, and I've been seeing students from then, and I've myself been a student, so I can share a lot of facts. So the way we approach in the current system, first to answer about the curriculum, ma'am, based on what all of us have been discussing, actually, in my perception, the curriculum then and now, except that it's become more refined and we've used the word competency, in my view, a MD, a master's degree, is about being competent. It's not just theoretical knowledge. One has to perform, one has to be competent. So the curriculum, the syllabus as such, has been by and large the same, maybe at least 70 to 80%. Yes, some components have been added. It has been more refined now to include quality management system and other aspects. However, the hardcore content remains the same. Having said that, the next aspect is about us implementing. Like you rightly said, different colleges have different infrastructure. Therefore, the extent to which we implement these is a big question. Now, talking on behalf of my own institution and my own behalf, like Anshu said, I do agree that an MD student has to get a good exposure across all the different aspects of pathology, surgical, cytopath, hematology, clinical pathology, which we do emphasize strongly. In fact, we post our students, like somebody said, that no longer MD pathology is a light course. My PGs do night duties every, at least twice a week. They are in the lab. They have to report urgent smears. They have to report urgent fluids, and of course, in consultation with us. So we really train them on the job. And since we are accredited for almost 15 years now, every week there are meetings with relation to identifying non-compliances within our lab. Within the lab, we involve them in audit activities, we involve them in documentation, sample rejection process. We take regular classes with specific reference to these aspects in addition to hardcore subject, say slide seminar, literature review. So there are classes pertaining to quality management system, and all of them have to attend these courses. We also give them competence assessment in terms, it could be an MCQ, it could be a case discussion and so on. So we really do our best to mold them in that direction. However, having said all that, somehow I strongly feel that a student's attitude and approach also matters to a large extent. Most of them get carried away by specialization and super specialization. Everyone wants to do fellowship in Tatas or do higher. Yes, I strongly, encourage them to do those things, but I keep telling them your foundation should be strong. What you learn in these 3 years, if you're good, your basic foundation is good, you will acquire additional skills as you go along. But right now, focus on basic skills. But they get carried away. Even in my own lab, they are eager to go and see flow cytometry. But if I give them 20 smears, they don't focus on that. Today itself, I had a problem, a bone marrow, megaloblastic marrow. If they don't know to correlate, clinical presentation is jaundice, bone marrow shows megaloblastic. So that reasoning skills, so those things I try to instill on them very much, but they get carried away by high funda things, so they ignore basic things. So a lot of student attitude also will go in a long way, how they shape themselves. However, having said all this, we make the best of efforts to bring out an all-round pathologist who could who could build up their skills as they go along. I'll cut short. I'll stop here, ma'am.
Thank
Maybe
you.
could ask.
Thank you, Sita. I think, what you are saying is that a lot of it depends, and Anshu said the same, depends upon the institution and institutional commitment to, bringing out the best in a student, given the context, which is the curriculum which you are expected to adhere to. So I want to ask Indu, because Indu, you're at Amrita, right?
Yes, madam.
Indu, are you there? Yes. Now
Yes.
you've heard a lot of what has been said. Where do you think we are failing our students? If you think that we're failing our students at all. Now, I can't sort of say that you are not probably failing your students because you come from a good institute, but I'm sure that you have students who come from other institutes to join your institute at some stage, etc. Where do you think we're failing our students?
Yes, madam. Thank you. Madam, as we have already discussed, I think the real world scenario difference is there between a student after passing out MD who joins a teaching institute vis-a-vis a private practice. So in a teaching institute, he or she gets enough time to mature to a confident pathologist, whereas in a private practice, they suddenly face with a scenario where they have to deal with the machines, the quality, then as we have discussed, the clinical pathology, biochemistry. And I think I will agree with Sita Lakshmi madam, as she rightly said, the aptitude and the attitude of the student also, the approach of the students also makes so much of a difference. And I should say that most of the time, we also emphasize mostly on surgical pathology, even though we have a distribution, fair distribution in the postings. We and mostly the students emphasize on surgical pathology aspects more, histopathology rather than the clinical pathology. So maybe there we need to do some revision either in the postings or in the exposure of the students, and also in the quality, more of the quality work. And I think there, if we can emphasize on the must-know points in the syllabus or curriculum, which the students should know when they pass out, and later they can build on that, I think that will make some difference in the
Okay, let's come to Vijay, Vijay Shankar. We have talked a lot about practicals. I mean, real world medicine means that they have to learn how to negotiate their way in, practical, the situation that they face in the real world. Do you feel that we are, in all this concentration on the practicals, that somehow we are losing out on concepts? Is Vijay there?
I don't think Dr. Vijay sir
hasn't joined.
today.
All right, then maybe I can ask Prasad to
Yeah.
take this question. Yes, Prasad.
Ma'am, currently I feel that our PG teaching is quite lean more towards concepts. That is the whole thing, that we don't get enough practical. I mean, how to handle the troubles with instruments, or how to troubleshoot a bad staining. Those things we don't get exposure during the PG time. But concept-wise, currently I feel our course is quite more lean towards getting concepts clear. And
Can you give me an example of that, Prasad? When you say concepts, meaning what is inflammation, that sort of stuff, or what?
Ma'am, I mean, yes, ma'am, that UG teaching itself is a very big step, because when you have to teach, your concept should be clear. So UG teaching about all the right from cell injury to neoplasia, that itself makes our concepts quite clear, because we have to study so as not to embarrass ourselves in front of UGs. So we study double for that class, practical class. So, and even during the slide discussion and all, apart from microscopic, some questions definitely are put forward by the consultants about the pathogenesis of the tumor or such things. So I think concepts are always focused during PG training. What is not much involved is the troubleshooting part. And slightly unrelated, ma'am, if I may, about some previous discussion, if some
Yes, please
points,
go
if I'm
ahead.
allowed to
Yes.
add.
Yes, please.
Since I knew that I will be participating, and I happened to have a UG class today. So I asked the students what was their favorite topic in pathology, UG students, second year. And I asked them the reason why it was their favorite. Everyone said that they like the pathogenesis part of respiratory system, cardiovascular system, neoplasia chapter. They like the mechanisms of carcinogenesis. And then all of them unanimously hated microscopy, the heart and soul of pathology. Yes, ma'am, that is the truth. So a person, UG pass out after second year, never seen the slides, they enter pathology. Who hated the last encounter with slides was not very good, with not good memories. I don't know how much knowledge we can squeeze in those 3 years. First 6 months, we have to make them like the subject probably. And as Siddharth sir also emphasized, it's not among the top 3 choices for many of them.
Yes.
So
I think what you're saying, Prasad, is that pathologists perhaps don't make very good role models. Okay, and I would say that, Siddharth has quoted some data. There is a lot of data that has come from the West, and they say that pathologists don't make good role models because pathology is supposed to be very dry and not very. And so you may be right, and I think Sita Lakshmi also touched the point that it's attitudes, aptitude, etc. that is also important. So if you come into pathology, not really it not being your top of the list choice, then you are going to and if you didn't like it as your
May I interrupt?
graduate, then you are going to have
Just for a minute.
issues with pathology. So maybe I can ask this question then also to Naveen. Naveen, what is your what do you feel? Are we really doing our students justice? Whether the curriculum does justice, do we as teachers do justice? Do we really, make students ready or enthuse them to the extent that they have a passion for what it is that they're going to do when they finish 3 years?
Honestly speaking, I think we are at a fault as well. The curriculum modifications will happen. You'll add 10-15% extra new things, but our crux is going to be the same all these years. One of the things that I feel is lacking is the students, MBBS students, do not know what we as pathologists do later in life. For them, it is a boring lecture or practical slides or practical in which we, like Dr. Prasad said, we expect them to make a diagnosis in 3-4 minutes, draw a diagram, not their forte immediately. So they are put off at that stage. And then when they come to pathology as a subject, like somebody said, they are just aghast by the wide range that we deal with in these times. I somehow not disagree, but I have a different point of view regarding the dichotomy that we are doing right now, medical colleges and private practice. So I think it is actually the same. The MD pathology has to cater to both in the same way, and it is the way we deal with it is the problem. And in that case, it's like how many of us were taught on analyzer science? Basics of that, what are flags, how to interpret a histogram. You can get diagnoses from histograms in these days. So it is with the faculty also, if I am away from machines, but just using their numbers, my PG will not get that exposure. So I always tend to get the hands dirty of my PG students, really, in the lab. So if you've made your own smears, look at how, like Dr. Prasad said, if the stain deposits are there, how to settle that, how to filter your stains, when to remake the stains, how to check the buffer pH. So I want them to be a technologist first, because that is what pathology is. We have our mind, yes, but you will interpret on the slide that the technician gives you. We must know more than them in some aspects to be able to train the technicians well to get our matter right. And I'll also talk about, I also believe hematology gives anybody independence fast. Limited number of cells, diseases that you can grab hold of, unlike the histopathology spectrum, variant of a variant of a variant is coming now with lots of molecular background. So that is a longer learning curve. So let's accept that. That is why you'll find most of the people, when they move out, you're doing either hematology, cytology, and biochemistry. Coagulation.
Would you like to continue?
Yes, ma'am, just two more points.
Yes, sure, please go ahead. Sorry.
So coagulation is another completely ignored area. So coagulation is, remember, PT, APT is the most common thing that you'll get in coagulation. Hemophilia, we know, is very rare, but all clinicians do handle a lot of acquired coagulation problems. That is a weak area with most of, even our training. Our training was a weak area. Coagulation is not exciting per se. You add a liquid to a liquid, it gels up, that's it. Nothing to see under the microscopes. You have to get them interested in mixing experiments, add normal plasma, get the time correct. So that excitement, like ma'am said, you have to ignite that passion. Otherwise, they are not going to do that. Another area, lab management. So if you think you are going to manage a lab, as soon as you go out, you will be in trouble. So lab management is a chapter in DAISY, costing of tests, how to assess your validity verification. And lastly, I'll not waste more time. I think the way we are doing the thesis very differently in different institutions, different universities, is a complete waste of time. PGs need a short 3 to 6 month project to understand the basics of research, and that's it. You can't imagine the pain they go through. They're putting studies off when the thesis work is going on.
Yes, I think that the thesis is a very big issue. It's part of whatever is required, and we will come to it we have to perhaps wind up in the next 20 minutes or so. But Sharda hasn't had. Sharda, are you there or are you traveling?
Yes,
Can you hear us?
madam, I have come back. I have reached home. I just wanted to know, I agree with Anshu because we are in a government setup, we face lot of problems. Then what Dr. Sita Lakshmi said, attitude and aptitude is very, very important. But one more point, I have got the shocking news from our postgraduates that why people do not take pathology by choice. Because nowadays they do as an undergraduate level, they join the classes for the NEET PGs like DAMS and Bhatia, and lot of classes are there in different cities. And there they teach them, don't learn pathology, don't take pathology as a postgraduate. That is the very shocking things that we come to know, and that is the reason people do not, good student, that pathology is not the top choice. No reason I feel that nowadays our medical teachers, they feel very shy to fail the students. Even if he is not at par, nobody wants to fail the students. And what is our time, what we have learned, that every time they were 100% result. So maybe that is the reason, that is our quality is going down. And the curriculum, as Anshu said, we are undergraduate level, that Anshu is part of MUHS. We have nowadays everybody is implementing as a CBME, the competency base. But now still we are not have started implementing for the postgraduate. Once it is start implementing competency base, like undergraduate student, we teach them how to take the blood, that is phlebotomy, even on the models. So they learn the things on the competencies which are defined. Similarly, in the pathology, MD pathology student has to done everything hands-on, but the student's attitude and aptitude definitely matters. That's the only thing I wanted to say.
Yeah, Sharda, I see that Asavri has her hand up. Yes, Asavri, what is it that you wanted
Could I
to
just
say?
interrupt about express my opinion about two things? One is there is no dearth of role models in pathology, madam. We all grew up or we chose pathology because of people like you or Madam Nagle in BJ Medical or even Madam Sharda Rane who's been my teacher. So there is no dearth of role models as such, I think. And personally for me, I chose pathology as my first choice. So there's, the only thing is that basically teaching pathology, even managing labs, is being done by academicians in the medical colleges. So maybe a mentoring program where a person who is in private practice can mentor students for some period of time about what is lab, how to set up a lab or what is real world pathology once you come out might be more helpful than ultimately just teachers who've been there for 20, 25 years in a academic setup teaching us about, these things. That's my, I think my personal opinion about this.
Sure.
That academicians are teaching lab medicine. Better would be to post PGs outside in private labs and make them aware of what is going on.
Yeah, so that was what I was. There are two things that I wanted to sort of touch on. One, of course, is the burning subject, and it invites a lot. We've even had a debate or a panel discussion on whether the theses should be scrapped or should be modified or whatever. I think that's one subject that we need to discuss, which we just had a very impassioned talk by not a statement that was made that the thesis is a waste of time. So let me ask, do you let's ask the students first. Do you think that the thesis is a waste of time? Payal?
Ma'am, I think thesis is only useful if the student is more into research other than academic. Otherwise, it is actually waste of time as there's lack of passion. And instead of thesis, what we can do is we can make one poster, paper publication compulsory.
All right. Nisha?
Ma'am, I
What do you
totally
think?
agree. I totally agree with Dr. Payal. It
You
is a
think that the
waste of
thesis
time.
is a
It is a waste of
complete
time because,
waste of time?
yeah,
All
yeah.
right. Okay, Gopal?
Madam, it depends on the subject of the thesis. It is new, related to new technology. If you generate the paper or publish it, it is better. Otherwise, it is same old topic, histocytocorrelation or like that, so it is no use. It depends on the topic.
Okay. All right, Kirti?
Ma'am, the same opinion that even my thesis I published just 2 years back. So while publishing, I thought I would have done during my MD curriculum. That would have been more beneficial for me as an academic career. So I feel if thesis has to be there, then a publication has to be attached with it. Thank you.
All right. Prasad, what do you think about the thesis? You're one of the younger guys who is now in an AIMS. So tell me, what do you think? I think that, they all say it's a waste of time because they feel that they didn't get anything out of it, and they probably spent a lot of time on it, time that they think that they could have usefully spent somewhere else. But do you think that there is a reason for not scrapping the thesis? You're muted, Prasad. Could you unmute yourself, please? Yes. You're muted. You're still muted.
I agree with Dr. Gopal that in case like thesis, ultimately it's like a gamble. If it results into a good publication, it is really, really helpful for getting job in academic institutes, especially. If not, then you have spent a lots of time which you could have spent in learning clinical pathology, serology, biochemistry, into doing something which has not even taught you proper research. So it's, if it is implemented properly, so Naveen sir's idea is very good, sir. It's like a middle ground that you do thesis, but like a short project, 3 months or so. That seems like a fair compromise.
Yes. All right. So most people. So now let's come back to Venkat. Venkat, what do you think about the thesis, and what is it that has been put into the curriculum? Would you like to say something about the new curriculum, because people have brought up things like competency based, and now of course we're discussing the thesis. And as Sita Lakshmi said, there's not much difference between what the old curriculum was and the new curriculum was. So would you like to address some of these issues, Venkat, because you're the one who's been part of the new curriculum?
Thanks. Okay, about the competencies, the entire curriculum of MD Pathology is based on competency based. I think people just need to read the 40 pages which are in the curriculum. All the competencies are given in the practical section, because that is where the theoretical, so in any curriculum you have a curriculum, then you have the learning objectives, and you have a syllabus. They are three different things. So it is for the university and the college to form their learning objectives in their various postings as to which part of the curriculum will be taught in which particular aspect. So a lot of planning has to go into that. Secondly, about the undergraduate, some people have raised. I am very sad that the time duration for pathology has been drastically cut. However, I have prepared a new curriculum for undergraduation in AIMS, which is under preparation. It has not yet been published, which has revamped our undergraduate curriculum, and the competencies are, although based on the MCI NMC curriculum, it is expanded and very different. Let us see how that is received. I hope the other AIMS who have the option also adopt the new curriculum. As far as thesis is concerned, the purpose of thesis is threefold. First is, a lot of people were saying, how do I manage a particular, how to make a buffer, how to perform a stain, how to perform certain tests which could be in clinical or lab medicine. So the thesis is supposed to teach the student by actually doing. For example, if your thesis is based on clotting, you go into the intricacies of clotting, and when you come out of that, you know that in great detail. The second, so for example, I did my thesis in a histopathology topic and lymphoma. So at the end of that, I knew lymphoma and the special stains, which was Agnors, and certain other special stains which I performed really well, because I had to go to the lab, cut the slides. I mean, somebody cut the slides, but deparaffinize, do the stain, and then interpret. Nowadays, our students learn immunohistochemistry because that is the majority of thesis which we give in pathology. But if you take a thesis in laboratory medicine, then you will do the detailed aspects of that. The second aspect of a thesis is to teach a student how to write. A lot of our students are, mobile generation, they really can't write. Writing a good report and writing a reasonably good thesis is supposed to teach them writing skills. They are also supposed to present these in conferences. If you look at the curriculum, there is a part or a section where they are supposed to do a presentation of their thesis work in a conference. That is supposed to teach them presentation skills in a larger forum than what a labs, departmental seminar or a journal club would expose them to. So all of these are also important aspects. Any other questions? I forgot the rest of the questions.
This is essentially, I am one of those who believes that a thesis or something that is similar, maybe, a thesis takes a whole of 3 years. But I have sat on so many of these ethics committees in which students' theses have to be passed, and I have been very disappointed by the kinds of subjects that that have been given by their guides to students. There is no research question that is asked. So the question of actually doing this. But what I did like, because many of these, I have been at sitting on these ethics committees where the DNB theses come up. Now, I am not certain what the MD thesis is, but at the DNB, they're expected in the first 6 months to give an outline of whatever the thesis is going to be. And Venkat, you can comment on that and what happens at the MD. And for that, and the DNB has to actually accept whether that that particular study is going to go forward. And I think that the students then have to be aware that they, at the end of it all, they may reach the final exam and not be allowed to take the degree. So the diploma. So I don't know what the system is now with the MD, and I think it's a good system that if at the end of it all your research question is not acceptable, then you just have to go back to the drawing board again. I saw Siddharth put up his hand, so would you say something, Siddharth?
Ma'am, I can tell you how it's done in AIMS. By the end of 3 months, you are supposed to decide. The students earlier, we used to decide who the guide would be, but now it's divided amongst the faculty. And then you can have co-guides from other departments. You can have from medicine, you can have from hematology, you can have. It is presented in front of the faculty, the protocol, and then it's criticized threadbare. You may have to go back and do it again. Every month, the resident and the guide is asked about the progress, and midterm corrections are made. And what Venkat said was right, ma'am. For example, we are fortunate to be in an institution where money is not a problem. So many do molecular thesis. They learn how to do a PCR on tissues. They learn how to do an electrophoresis, so on and so forth. Many of these things are. And above all, what Venkat said was right, that they learn how to write. That is something which is often
Yes.
something that is not.
But I think Siddharth, you and Venkat come from an institution
yes, I
where
fully
this, and it doesn't really have to, like Siddharth, like Venkat said, that you can even have your own curricula, but you're not bound by a system. Okay, there's nothing like that. Freedom is a great thing, but I'm looking at it from the point of view of all the other institutions in this.
In the other institutions, what has happened is the number of residents have increased tremendously in all the departments. Many of them do thesis related to pathology because that's how the many researchers, and the number of cases are limited. So you see what happens is many of them are not, they don't, what you said exactly, they don't answer research questions. The students are bogged down with work and this thesis,
Right.
so they just hate
So
it.
then that brings us back to the real world. And there are so many students over here who said that, you are not really helping us in the real world by taking away from us time, that we could usefully spend somewhere else. Because as I think Naveen also said, that a lot of people get shocked when they come to pathology. I think Sachin also said it, that, you come to pathology and you think that it's going to be or somebody else said it's very cool and you can spend a lot of time and maybe have a good time, but then you suddenly realize that you have to cram a lot of work into 3 years, and perhaps the thesis has to be looked at in a slightly modified kind of form. I think we do need to teach students how to even read a paper. Okay, because doing is one thing, writing is another, but how do you critically read something that is published? If you cannot read what is published and you just take anything, the written word, as the gospel truth, and you do not know how to evaluate a paper, that's something I think that a thesis or a project of some sort helps you to do. I think this is a very vexed question about the thesis, and I don't think that we're going to, sort of solve it anytime soon. But I take it from whatever Venkat said that it is still part of the curriculum, right? And it is a necessity. Venkat, in the new curriculum?
Yes, it is a
Not
necessity.
going away at all.
It is not going away.
Government is in the process of uh, giving topics which matter to the country as a list of research questions which they want various different departments to address. They're going to put this up. They're going to have a national repository of research questions, which people feel that, for example, what is the status of celiac disease in various parts of India? So you have 100,000 or I don't know how many, I think 40,000 MDs or rather postgraduates. I forget the exact number. All of them every year are doing a thesis. That is a very big manpower. And by not asking nationally important questions, actually we are wasting our time and effort. By asking the right questions, they are in the right direction. The coordination is required to implement it. But such a big workforce of MD students, all of whom are required to do a thesis, all you have to do is tweak it so that we answer important questions.
All right.
The thesis is not going away, so
It's
let
not
us.
going away. So now we know that that is for.
And ma'am, another thing is, you can do a thesis, somebody does one part of it, the next batch does the next part and extends the work as
Yes, that's what generally happens in research laboratories, where you look at one part, one aspect of a question, and so
Madam,
forth.
can I add the undergraduate thing? The problem is many people teach undergraduate pathology so that they become pathologists. That's not the intention. The
No, I
intention
understand.
of undergraduate pathology is to make them understand medicine. And that is where pathogenesis is more important than the.
Exactly. I agree with you, Siddharth, and although Asavari did say that role models is not the problem, it is a problem, Asavari. It's a universal problem, because there are very few medical colleges in which the surgeon or the physician or the obstetrician is not a more outstanding role model than somebody who's in anatomy or in pathology or in pharmacology or something of this sort. So yes, we do have a perception problem. There are three hands that are up, and I will go to Sita Lakshmi first, and then to Sachin, and then to Prasad.
Ma'am, I just wanted to add, in the context of thesis work, all of us, I mean, there were many faculty who shared asking the right research question is important. And for this, ma'am, because obviously the student, when he just gets into an MD program, does not have much clue about all this. So a lot depends on the faculty or the guide who is asking that research question. That to a certain extent depends. For example, if I worked in a particular area for so many years, I would rather give my student some topic related to that, so that my own knowledge improves and the student also does some work. So it depends on faculty need to be trained.
I absolutely agree with you, Sita, that and Siddharth made the point that there are so many medical colleges in which they're struggling to get enough material on which they have minimal amount of material, and their clinical faculties are also not up to the mark. So I take your point entirely. So I think Prasad, your hand was up. Where is Sachin? Sachin, you wanted to say something?
I wanted to say something. Regarding students hating microscopy, that the reason I feel is that because it's difficult to sort of see the cells properly through microscopes which are not of good quality. So since the time we have decahead in our department, everybody is looking forward to microscopy. I think it is not that microscopy itself is bad. The way we look at it, that is the problem. If we don't see it properly, if we don't focus it properly, our high power is not working well, something is the issue, then people start hating microscopy. That is one point I wanted to make. Since decahead is everybody is in love with microscopy, everybody wants to sit there. So if the quality is good, they will love it. That is one.
Thank you.
Second point was
Yes, continue.
One more thing I want to do was share my screen.
Please go ahead.
Have I shared the screen? Is it visible?
No.
Okay, even if it is not visible, I will just read out few suggestions that came in our study regarding the pathology curriculum. Yes. First suggestion was incorporating internship in a private laboratory. Interesting. Then second suggestion was to invite private practitioners for discussion at the time of PG activity. That is interesting. And there should be more fellowships which should be available so that people can specialize in area of their interest. And fourth suggestion was there should be clinical integration in the form of clinical postings for pathology residents in medicine, surgery, and vice versa. Regarding blood bank, opinion was divided. There were few suggestions for shorter blood bank postings. Few suggested that teachers should teach actively what they know to their students rather than just from the textbook. They should share their experience. That was some suggestion. And suggestion was there should be separate MD for histopathology, cytology, and hematology or combine biochemistry, microbiology, and clinical pathology as MD in laboratory medicine, which is already there, as Dr. Siddharth sir was saying. And there should be separate MD in cytology and histopathology. Such suggestion was there. There are three more suggestions I will read out, and then I will stop. Few respondents suggested that there should be more practical orientation, including lab management and quality control. So once you are thrown in the deep end of the swimming pool after passing out the MD, the first thing that is challenging is the lab management that everybody has experienced and everybody has shared also. So that is one area. And multiple respondents suggested providing knowledge regarding practical approach towards handling clinical laboratory, mostly biochemistry part. So that was the challenge that most of the pathologists face. And one last suggestion was increase MD pathology curriculum to 4 years to give justice to all aspects of pathology. This might not be very popular, but these were some of the suggestions that I wanted to share. Thank you.
Yes, I think Sachin, you have actually encapsulated a lot of what I was going to ask or even to suggest, and for people to come back with this before we launch into how to examine, to assess students, and whether or not AP and CP, as it is done in America, anatomic pathology versus clinical pathology. Be something that we could think of, but I think given our 3-year curriculum, it's very difficult to actually do this unless what Anshu had suggested, that a student after the first 2 years or so decides that by that time you get a fair idea of what pathology is all about, what you like, what you don't, and maybe elective postings in like a lot of MD pathologists in Mumbai get posted in places where there is some particular speciality. Many of them go to Tata Hospital, some of them go to other places. I'm sure we have, Kirti would be able to tell us that she might have done a posting somewhere in, if she was interested in it, in nephro or something of that sort. So it's about how you can elect to do something if you want to. There is another option altogether that people can be rotated compulsorily in a private lab, which might have all of the different, sort of branches of pathology, and really, have them at the way that pathology is supposed to be practiced, where the infrastructure is probably not as good in the teaching institution. So that's something that maybe we can, could consider in the future, if private laboratories can be co-opted to be part of the training or teaching experience. I see the hand of Dr. Prasad up. Prasad, would you like to? And then of course Kirti can come in, and I think Asabri is still with her hand up. Yes, Prasad. No, you've muted yourself.
Ma'am, just what you said, it's very true that it's universal picture that what I have observed, I have worked at, I have moved around lots in the country. What I have observed is that bigger institutes focus on IHCs and PCR and molecular, but we are not able to identify caste and crystals in urine. On the other hand, the peripheral colleges focus too much on this because they don't have facilities, so the students have no exposure to IHC. So what you suggested, ma'am, or what Sachin sir just said, that some way of collaboration, and how we implement that collaboration. Basically, we also had posting outside to get exposure, but I mean, it was more like a guest posting. Somehow we were not involved. We stayed there, but unless we are really it's the adult learning. There's some funda called for adult learning. Unless you are involved, you don't learn. So somehow we have to get the PGs involved, and otherwise there's no point of posting.
Okay, thank you. Kirti, you wanted to say something.
Ma'am, so ma'am, I have 2-3 suggestions. Firstly, I want to say the positive point I had in KEM, that I had autopsy based learning with good autopsy meeting that we had on regular basis. Believe me, ma'am, as a practitioner, I have learned a lot of clinical correlation through my autopsy study. So I feel the autopsy study has to be there compulsory. If some institutes are not having autopsy, they should have some posting where they are. Then secondly, in during my MD curriculum, at the end of MD curriculum, there was some slide library session was conducted by Metropolis Lab, and which in our third year. So we got those slide of different cases which were not exposed to us. So we got that knowledge through that slide library. As soon the MD curriculum as such is very vast to study the histopathology. So since first year we are so interested in the histopathology. So shrinking that to a slide library will and more focus towards the immunoassay, HB electrophoresis, biochemistry, HbMSc. These are actually a bread butter thing. Ma'am, being a private practitioner, when I started see the private practice, histocytopathology is the last thing anyone opt, because the setup is very costly, it needs lots of experience, and the risk involved is also high. So as a private practitioner, bread and butter thing is biochemistry, immunoassay, and now the molecular thing is and hematology and clinical path. This is the bread and butter, so that should be more focused and trained in curriculum.
Thank you. Siddharth, I'll come to you, but I have, Sarvi, would you like to say something that?
Yes, ma'am. From my experience in this Malaysian college, there is an acronym which they use for their curriculum. Since we are talking about designing curricula, that is SPICES. So that is student-centered, problem-based learning, which is integrated, community-based, and with electives. So if we can maybe incorporate all of this into, and that is at undergraduate level for them. But if we can incorporate
That's
that
problem-based learning. There are pros and cons of problem-based learning, the way that they have introduced it in Malaysia and so on. And I think that's a subject for a whole different debate. I can tell you straight away that I'm not a great fan of problem-based learning right from day one, which is the way that it is done in many of these countries. I'll come to everybody. Siddharth put up his hand before.
No, I think
and Anshu, yes.
I think Payal and all put up before me.
Oh, did they? Okay, Payal, come on. I didn't notice that. It's not that I'm favoring Siddharth. Come on, Payal.
Ma'am, I would actually like to suggest 2-3 points. One is that we can decrease the posting in blood bank, as there are IHBT available now, and by that, instead of having posting in blood bank, we can give outdoor posting or elective postings in flow, then IHC, digital pathology, molecular, and all. Second point I would like to emphasize on is that for making PG residents understand quality properly, we can make NABL ISO 15189-2022 training program mandatory for them, so that they will get a proper idea what quality is, what is to be done, how ICAS are run. And third point is, ma'am, that teaching class should be held for the PG students by faculty instead of seminars. So basically, if institute like Tata, where workload is unimaginable, can do teaching class for students, why not other institutes?
What do you mean by teaching classes for students?
Teaching classes as in, ma'am, where a teacher, as in faculty, teaches to the PG student.
You mean that that in other institutions, faculty doesn't teach PG students? I don't think that that's necessarily the case, Payal. Perhaps this varies from institution to institution, but they are supposed to. If you're talking about taking formal lectures, there are different views on whether formal lectures help or don't help, whether one-to-one interactions are better. And just now somebody talked about problem solving. So if you have a problem, and then your competency will increase. If you are discussing something on a one-to-one basis, many things can be thrashed out. Okay, so yes, that's a suggestion, which is your point of view. Yes, Siddharth, come on, and then we'll go to Anshu, and then I'll just
Ma'am,
sum up.
can I just share something, ma'am?
Yeah, sure.
Yes, ma'am. This is what Dr. Sachin and all found out, in which the best was hematology and the least confident they were in blood bank. Now, it is not that our curriculum is bad or our way of teaching is not sufficient. This was found in US. Most of the residents felt that a fellowship is needed before they can practice, and even the employers felt that they were not ready for practice after their rigorous residency. And in fact, if you see over the years, more and more are dropping out of jobs and they are taking up fellowships. If you see, ma'am, this is happening in the US and this is true elsewhere. And for example, even in China, when they did a study of second year PG and third year PGs, pathologists who passed out 1 year and then 2 years, the green is that they are quite confident who can sign out common or all types of cases. You see, it takes time, ma'am, for all this. And even there was a big survey of US all pathologists within 5 years of there, and their findings are exactly what everybody has thought. What they need to learn more is lab admin related to leadership, financial management, personnel management, then lab informatics, information management, lab specific project management, LIS, and so on and so forth. Molecular, which is required more and more. They are weak in molecular, this in infectious disease and tumors and hematopathology, and it's mainly molecular and others. There were 65 parameters that they studied, including autopsy, the usual ones, GI pathology, neuropathology, and so on and so forth. And most of them, whether they passed out or they were passing out, felt exactly what has been told by everyone. And one of the reasons, ma'am, in our country is that, you see, there is a stage of learning that is from novice where you don't know anything to expertise. And somewhere, I think we take our exams before they become fully proficient. The reason why I am saying this is, ma'am, you see the postgraduate training in pathology in different countries. In India, after schooling, undergraduate medicine and others, in 8.5 years, if you're, going through it without any gap, you can complete your PG training. Whereas in United Kingdom, it takes 15 years. US, it takes 12 years of residency, and nowadays everyone is opting for a year in fellowship. 13 years. Canada, 13 years. France, 12 years. Australia, 11 years. China, 9 years. Sri Lanka, 12 years. They follow almost the UK system. Bangladesh, 10 years. And of course, Singapore is another 11 years. They also follow somewhat. Therefore, in our country, if we now want to add more and more, it might be a little difficult and we're tight for all the.
Yes.
And we forget that our residents, first of all, they need, pathology is a descriptive subject. They need to learn the language also well of how they write and so on and so forth. They are not exposed to pathology like in UK, ma'am. The Royal College holds certain workshops for undergraduate students in pathology. So they are more or less interested in that. What I suggest is after postgraduate training, they will require a subspecialty, whatever they want to do, lab medicine, they require a training of 1 to 3 years. Although, and in fact, the NMC has recognized this. They always, earlier it was after MD you could just join as a teacher. Now they want at least 1 year as a senior resident. This is the recent one to do. So I think it takes time, madam.
Yes,
And
it
in
does,
fact,
Siddharth. And the internship was really meant, certainly in my days, it was meant for you to, after you have finished your exams and you don't have to worry about, bashing the books and all that, to learn, medicine and to practice.
yes, I agree with you.
But the internship has been devalued to the extent that nobody even tries to learn anything. Everybody is busy going to classes and coaching classes and so on, because they want to take their NEET or whatever those exams are to get into a postgraduate degree. So I don't think that there is any sense. See, after our MBBS, we used to be fairly competent to become general practitioners.
I agree with you, madam.
Because we had that internship. Now you finish your MBBS, you have so-called done your internship, but you are completely incompetent, to man any kind of general practice anywhere, and you don't want to do it anywhere because MBBS has been devalued. Now, from whatever you are saying, Siddharth, that people after they have done their postgraduate qualification now need to go and do some sort of internship, because we are calling it a fellowship, or you're not going to call it an internship. And I absolutely agree, but this brings us back to the fact as to how much can you cram in 3 years.
You can't, ma'am.
No, you can't.
Just,
So if
and in senior residency, ma'am, you are away from all encumbrances, no thesis, you don't have to run around.
Yes.
You are free to learn. You just learn the
So this
subject
is something that should be incorporated, just like the internship is incorporated, although it is been completely devalued now, that it can be incorporated into a training program or a course or whatever, which is perfectly legitimate. So you may not, and that may be a good time to do electives and many of the other things that the students have actually been.
Ma'am, in Sri Lanka, after you finish part 1 and part 2, 1 year you go to a local place for training, and 1 year you can go overseas. We sometimes had Sri Lankans coming to us. That's like some Dr. Sachin said that people, yes, you go to a lab and get trained. In fact, some of the bigger labs where they do DNB training, they are more well versed in lab medicine and clinical path and this rather than maybe from our institution.
Yes, I think we've done 2 hours of this thing. I'll ask Anshu to say whatever she wants to say.
Ma'am, finally one thing, ma'am.
Yes.
In our country, we are also laboratory managers. We don't have other managers like in say UK and all. The people who do this senior technicians, they can manage the lab very well. But here, a pathologist is not only an academic pathologist, but he is also a lab manager.
Yes.
Thank you, ma'am.
Yeah, Anshu?
Yeah, I just wanted to take on what Kirti said about the power of multidisciplinary meetings. And that's something I did not experience until I went to the morning meetings at Tata. So, and I realized there how important it is for pathologists to communicate well with clinicians and know what their protocols and what their management treatment part is, which most of us in the peripheral institutes are not exposed to. You sit at your microscope, you stick slides under them and you report, and there is no correlation which is actually happening.
Yeah,
I agree. I would like to talk about the oral communication, but also the written communication, how you write your reports, and especially the point of how you voice your uncertainty. One thing we do not teach our students to say is, I don't know. And knowing your limitations, knowing where your weaknesses are, and how you're going to do train yourself in those areas, especially after you graduate. Uh, the CPD part, the continuous professional development of knowing which courses to take, how to upgrade yourself all the time. Those are things we have to still emphasize in our
Absolutely, and I agree with you. Communication is very important, and people think that you only need to do that if you are writing histopathology reports. No, it's about interpretation of clinical data, whether you're doing blood banking or you're doing clinical pathology or anything. Uncertainties are there everywhere, and I thank you, Anshu, for bringing this up. I have just one question, and it is a provocative question, but don't take it, amiss. I just like to stir the pot a little bit, and I want all of you to just answer that question. If I were a person as an administrator in a hospital, and I have the job of of the head of department of pathology in my in my hospital, and that is a private hospital, obviously, that I'm talking about, and if that is vacant, what do you think I should do? Should I really hire somebody who has been in academic, in other words, somebody who has been the head of department of pathology in a teaching institute, or should I look elsewhere? So now let me ask the question. It is a provocative question because you have a lot of people who retire. Yes, and Siddharth, I have retired and I'm doing histopathology. You have retired and you are working at St. John's. But that's all right. If you're doing a specialist job, fine. But if I'm the head of a lab, and you know that most private hospitals have one head of department, and that head of department is supposed to run that department, which is clinical, this, that, and the other. And you have been teaching pathology now, okay? So who'd like to start with that question? It can be answered by almost anybody. Maybe any people in the chat box can say yes or no. It's provocative, but because I think that what we teach is what is to students to make them competent to go out. Are we in the end competent to do what it is that we are teaching students to do? Because that ultimately is the test of our ability to be mentors or to teach, etc. And in most heads of departments, there, if all right, if you are doing only histopathology, that's a different story. But most heads of departments, are heads of departments, and they are doing everything. Yes, Sachin, you put up your hand. Tell me, would you hire
I would like to
somebody?
take that up.
Yes, please.
I think somebody who is having experience in a private lab would be more suitable for the challenges that private hospital laboratory poses rather than an academic head of department. My choice would be of somebody who has already done some work in a private pathology laboratory, because he knows the nitty-gritties of and problems of a private hospital laboratory.
All right,
And,
Sachin, that's your vote. Excellent. Prasad, do you want to answer? You don't have to answer. It is just a question that because I see this day in and day out in when people are looking for it, sometimes they do hire people who have worked in some of the teaching institutions, and I just like to have your view. You will one day become the head of a department. Would you be happy to or confident enough to run a lab in a private hospital or a private standalone lab?
I'm very difficult to say at this. It's this question would require, I think, more experience for me to gain before it will take few years.
That's good. Sita Lakshmi.
Yeah, ma'am, I wouldn't just go by the designation, because it's important to look at their job profile, what they've been doing over the last so many years. For example, in my own case, although I'm attached to an academic institution and teaching is an important aspect, I do a lot of diagnostics, a lot of lab management, as good as any private setup would be. So you have to look at the job profile. We just don't look at designation and accommodate somebody.
You have qualified your answer. Yes, Naveen?
I feel that's my personal opinion that probably from a teaching institution, if you are heading a department, we will usually lack the managerial skills required for a private setup. It'll be scary for me. It'll be scary for me to begin with.
It'll be scary for you. Anshu?
I can't answer for anybody else, but for myself, if somebody gave me a job like that, I would definitely say no, because a mindset.
You wouldn't apply for it. Good.
Yeah, I wouldn't apply for it. I mean, I'm comfortable in an academic institution with support, and to take up a job like that where the pressures are completely different, it's not my cup of tea.
All right, Kirti, you put up your hand.
Yes, ma'am. What two perspective I feel as a private practitioner, the marketing and the financial perspective that are not get exposed or learned by when I was in academic. So in academic lab, I was handling entire lab, but there I was not bothered about marketing, neither the finances. While in private setup, I'm much more worried about this perspective. So I feel if it is a private setup, the exposure has to be in that experience and not the academic one.
Okay.
Thank you.
All right, Siddharth?
Ma'am, I think what others said, I would completely agree that we in academic institutions, ma'am, are molded in a much different way. And especially oldies like us, we are not exposed to automation to that extent in an academic institution because it's all separated. Lab medicine is separate, hematology, everything is specialized. So while we may know to manage people, but to manage a lab with all these things would be difficult for us. So I think I would not fit the bill actually.
Okay, all right. But I think that if you're specialized in a particular thing, if you're doing GI pathology and somebody wants to hire a GI
Oh,
pathologist,
that's fine. Not
it's a
at the
different
head
story,
of the
but
lab.
not to the head of a lab.
Head of the lab.
Exactly. I
That's
absolutely,
something I
yeah.
want.
Okay. Venkat, do you want to answer that question?
I agree with Anshu. If I was offered this job, I would refuse straight away.
you.
But having
Right.
said that, if you are, it depends on what. Suppose you have some college, I mean, a hospital like Medanta. Now, Medanta does a lot of histopathology and they do excellent histopathology and they look for specialists and they look for people with wide experience and they are ready to pay to hire the expertise they need. So they can pick up ex head of department of some medical college and hire him. But if it is a smaller hospital which does only, lab medicine, he's not going to pay for that. He is going to hire what he requires. Most private hospitals have usually already sorted out their lab medicine issues. It is one of the biggest earning areas for their hospital. And generally, they have excellent lab managers already and excellent, auto analyzers already installed. They have better than
But
we.
Venkat, you're not talking about the real world. There are all kinds of institutions, and I'm talking from experience because I see, labs in Mumbai and in all sorts of other where the heads of departments are actually being recruited from, institutions where they were heads of teaching institutions in pathology. So I guess it depends on thing. Maybe I'll ask Indu. Indu, do you feel that you would go out and become a manager of a lab?
Not at
That
all,
means
madam. Not at all.
you wouldn't do it either. Sharda.
Yes, madam, I will love to because of being in a government setup, I still work as a private person. And I am ready to go anytime to the private setup, but still I will take it as a histopathology is my branch, but I will manage the show because I like to take challenges.
All right. So I think if there is nobody else who wants to answer this question, Asavari, you've already managed a lab in the private sector, so I'm not really asking you this question. So
Ma'am, I typed it in the chat.
You typed it in the chat. Let me see what's in the chat.
Madam has written that she would choose someone who has worked in a private lab.
She would choose somebody who's worked in a private lab. All right. Shrutika, can we just ask if there are any questions in the chat box?
Yes, ma'am. I've already compiled. They are more of suggestions rather than questions.
Okay, so please let us know about that, and then I can sum up, and we'll
Ma'am,
close this discussion. Yes.
Sure.
Ma'am, before you sum up,
Yes.
there's something, ma'am, in our training also, ma'am. Somehow I think we are not training also properly because lot of things which are done abroad in which they are actually everything is graded and trained until they are sorry until they are proficient in certain things they will never be allowed. Can you just see this? I'll just show you two of the
This is the
grading
RCPA system. Yes.
RCPA in Australia, ma'am.
Yeah.
They do all this, how many they have to do, and the supervisor.
And they keep log
trains.
books and
They keep log books,
yeah.
how many MDTAs you have attended, frozen sections, everything they have. The other thing is, ma'am, they have a whole lot of documentation. Like frozen sections, they also see how you communicate with the surgeon, what people have been talking, what you have also been telling. It is not only the skill of a frozen section, how they communicate with the surgeon, that is also assessment. And the every college has got or every country has got how many cases you are supposed to see. Now you see this is of the Royal College, this is in how many autopsies in US you have to do, 2000 specimens you have to write and report and everything. But here madam, the workload, what the what the NMC has suggested in the recent thing is that for pathology, surgical path load should be 20% of the surgeries and cytopath should be 1%. And similarly, for everything they have given certain numbers. And I have taken for some of the major institutions, ma'am. In the larger institution, there won't be a problem with surgical path because you get lot of OPD biopsies and daycare biopsies. They are not major surgeries. But in smaller institutions, it will be a problem. And cytopath, where there's a lot of OPD overload, the number of specimens of cytopath will be less. So rather than that, I feel that we should go back to the number of slides a person should see. That is very important, ma'am. That those numbers are more important than the
I think
total
that
number.
Venkat, if I saw this, yes, it is a percentage in the MD curriculum, the revised curriculum, but you do have logbooks, and this can be.
Yes.
I think that has been introduced now, and maybe you can address what Siddharth just talked about.
Logbooks were there earlier also, ma'am, but it was not
In
followed.
MUHS system, there is a logbook. Yes, right, Anshu?
Logbook
We have
was
a,
there since beginning, but
We
yes,
do
yes,
have
yes.
not
logbooks, but we need to
followed
structure
properly.
it so that people come out properly. Otherwise, they copy logbooks from each other. That
Just
makes no
copy and
sense.
paste. Yes.
That's exactly what.
Okay.
So I think you got it right. The logbook was always there. Now they have a extended logbook. They do have some requirements, but most of the time, even in our department, the students are little lax in following entries and getting it signed because there's a lot of paperwork. So it is important that the teachers and the institutes focus on keeping the logbook very, meticulously. That is important. And I just wanted to say one more thing, and that is that it's really an eye opener to see just how much laboratory medicine is required in this country from everybody who has spoken. And I would, so if you look at the number of seats, no, there are 2,500 MD seats in pathology, give or take a few. Only 59 or some such number for transfusion medicine, and only 17 in laboratory medicine. So there is a huge disparity in number of seats, and I would request Dr. Sharda Rane to take it up next, that we convey to the government that look, we have 2,500 seats in pathology. AIMS is not the role model. It is the smaller colleges who have to take up laboratory medicine as a major component, and the flexibility in the number of hours exists in what we have written in the curriculum. They should increase the number of hours devoted to lab medicine. I think that is crystal clear from whatever has been discussed today.
Venkat ma'am, one thing, there was a suggestion that the basic MD pathology, 2 or 3 years, should be predominantly lab medicine with little bit of histology and cytology and the other and blood banking also. And Venkat, what was suggested was later, Dr. Ashok Mukhopadhyay, who was the head of lab medicine and he made the lab medicine curriculum, he was pressing that let that be the basic, and then you have specialization in AP or CP or
That's
whatever.
the DM.
The DM part of
Yeah.
it. So, but that
No,
anyway,
that requires a complete
that
overhaul.
requires a complete overall. It was not
Yes, of the
taken.
Sadly,
system.
the lab medicine program hasn't really taken off, no? Even
Yeah.
in the new aims, they have pathology and lab medicine as combined departments, and they're not offering a lab medicine degree. So until we have little more teaching facility for lab medicine, pathology will continue to remain the base subject,
That's the
which
core department.
Yes.
that is not going to change.
Venkat, actually, you have summed up whatever we have talked about very eloquently, because that is what I was going to say, that what came out of this discussion is that students don't feel that they are being prepared for the real world. And the real world seems to be laboratory medicine. It's, you know, NABL also recognizes that there is such a thing as the MD in pathology, which includes all of these. So somebody who's an MD in pathology can sign out clinical pathology, hematology, histopathology. You know, he's competent to do that according to the accreditation body, okay, except for microbiology, which has a separate, you know, sort of qualification. So that is what the accreditation bodies require you to do. And that's what, you know, what most people believe, those who go into pathology and those who come out of pathology, that this is should be our core competence. And you've seen it being reflected in today's discussion. So I take Venkat's point very seriously, that the curriculum has to be based on what the real world is. And the real world seems to be that it's clinical, what the Americans call CP, that's clinical pathology. And perhaps we need to reorient our curriculum towards, or the teaching towards this. Venkat says that, you know, you have some range. I don't know how large is the range, Venkat, because I don't think that there will be certain limitation to how much.
Yeah, let me just open it. Where did I?
Because I don't think it could be, you know, sort of 24 months in CP. That
No,
would,
no.
24
It
months.
isn't.
I think you can easily do something like 6 months in CP, no?
Yeah, but
So
6
that
months in
is
CP,
easy. That is
it's
sufficient.
really
It's
as
not,
good
you're
or
not
as
going to
bad as
learn
not doing
more.
CP at all.
Nobody
So,
is going to learn more by just sitting. So if you look
No,
at the
Venkat,
I just
Venkat,
opened it.
ma'am, the main problem is whatever is written there, no, the colleges want to follow it like gospel truth. Nobody wants to change a little bit for fear of
I
derecognition.
think also, Siddharth, that
That is the problem.
colleges use students, postgraduate students, as a pair of hands. So wherever they, yeah, I mean, let's accept that you know, wherever they need postgraduate students, and Anshu said it also very well, they post them in areas which is convenient for running their services, rather than, you know, for the convenience of the students who want to learn. So I think that is one of the things that came out of here. Also, what came out of here was that because the curriculum lacks certain aspects, or lacked it, it may include it now, and that is stuff like quality assurance and lab management, etc. This makes you know, students even less confident when they leave the lab, and if they want to start a clinical. But I can just say something about that there are very few people who want to go straight into private practice. You know, they are all looking for a super specialization now, and it's only when they can't get hold of super specialization or jobs and fellowships and senior residencies that they actually go into this. And this usually happens in very small towns, etc. But nonetheless, this needs to be taken on board, and we need to give students at least an idea of how to manage things. An elective is very important. You know, sort of training them for their competencies is important. And I think a lot of people also talked about communication, and I feel that has not been taken seriously. This is not taken seriously. I don't know if they are doing it now in the MBBS. Certainly it was not taken very seriously when I was doing my MBBS, and I often feel that, you know, a lot of the miscommunication is probably the cause, or poor communication, let me put it that way. A lot of the problems that you face in hospitals, major hospitals, maybe even government hospitals, because those who are on the front line dealing with patients, whether it is a death or it is, an acute kind of episode that happened, is just not communicated in a sensitive and a, appropriate kind of manner, which leads to, disappointment, anger, and even violence sometimes in these institutions. It won't happen, I don't think, to pathologists, but not the violence part anyway. But I think that doesn't mean that we shouldn't learn how to communicate. I think we've had a very long session this time. Do you want to tell us, is there anything pressing that we, except for comments?
I think there's one question. One of our audience wanted to understand what is the basic difference between pathology and lab medicine.
And lab medicine. Come on, Venkat. What is the basic difference between pathology and lab medicine?
Everything which is automated goes to lab medicine, and whatever cannot be automated and human beings have to do is pathology. So if you have to sit at a microscope and see, and human beings have to do it, that's pathology. I'm just in a slightly lighter way. But
no, I think that Venkat, you have made it into a very light thing. I think, it's a question of pathology is a very general it's an umbrella term. And what you do in clinical, in clinical practice that does not have histopathology as a major component, cytopathology as a major component, and, cytology, what Venkat said was right. Cytological examination of bone marrows and, smears and all that is laboratory medicine. More and more, things like even urine analysis have become automated. Now, lots of people have automated urine analyzers, which do everything, including looking at cytology of urine, meaning crystals and this and that and the other. So it's really CP as opposed to AP. That is what I would say. Anatomic pathology on one side and clinical pathology on the other. That is my way of looking at laboratory medicine. But Venkat has given his viewpoint. Okay.
Just wanted to say a few things, if I may.
What is traditionally clinical pathology and clinical biochemistry,
yes,
as well as a part of hematology, is
yes, that's right. So it is what people would consider CP as a as that, and anatomic pathology on the other hand. Okay, do you want to show your results today, or we'll do it the next time, Shrutika? I think we can do it before we start the next one on the examination. Yes, because
Can I just have a word? Can I just have a word? This is Dr. Sachin speaking.
Yes, please, Sachin.
Yeah. Ma'am, regarding the remark about violence and all, so we had an experience where one patient was made to run from pillar to post for his blood group report, and somebody has lost it in the ward, and patient was not sure where to get it, and he came in the ward and started banging on the glass door. So he was quite violent. We have to call code violet and get all the hospital machinery in place to contain that patient. So that happens to laboratories also, ma'am, and communication is important in that regard.
I understand, but that's a rare sort of thing, because we are more or less shielded from interaction directly, except for those who are phlebotomists and other patients over there. Other people who are working in lab medicine. Okay, so thank you all of you very much. Sumeet, you're there. Would you like to say something? Has Sumeet disappeared? He's traveling to Pune, I should imagine, because Sumeet cannot sit still in one place. If he's not traveling, he's uncomfortable.
No, I thought he had a workshop today, ma'am.
No, tomorrow.
Tomorrow.
He's got one in Pune tomorrow. He might have had one
today was in Manipal.
In Manipal.
So he's not here, madam.
So he was there. He joined for a while, but he's on his way to Pune. I know that because tomorrow he has something to do there. So thank you all of you, and I see that there are a lot of people who in the chat box have agreed and disagreed and also made suggestions. Thank you all of you for, we didn't have we had about 70 odd participants, and we will know after Shrutika does her tallies as to how many of them agreed, disagreed with the questions that we asked, or at least commented on them. So till we meet again on next Tuesday, thank you. I have enjoyed this tremendously. I hope the participants did, and all of those who actually listened to this I think very interesting panel discussion, because everybody shared their views without any kind of reservations, have been very open and transparent, and that I think makes for a very good discussion. So thank you all.
Thank you very much.
Thank you, ma'am. That was